Mosquitoes are not just annoying. They are also capable of spreading diseases that can harm people and animals. Here in the Twin Cities, we control the mosquito population to protect public health and make the outdoors better for residents. It's important that the methods we use are specific to mosquitoes, with minimal harm to pollinators, wild animals, and the beautiful and diverse environment that makes Minnesota great. How do we do this? It's called Integrated Pest Management. IPM uses a sustainable, science-based approach to reduce the target species with minimal impact on health and the environment. It starts with surveillance. After mosquito eggs hatch, they begin their life cycle in the water as larvae. Field staff check wetlands after it rains or at locations that have been determined to be likely mosquito habitats. A long-handled dipper is used to collect larvae, and specimens are transferred to a vial and labeled. Staff also collect adult mosquitoes using various traps or a sweep net. Next comes identification. Samples are sent back to the entomology lab in St. Paul, where trained staff use microscopes to identify the different species. Not every mosquito species bites mammals, so lab staff determine if larval samples are human biting or if they're a species capable of transmitting diseases. Adult mosquito samples are separated by species, and maps are created to show the abundance in different areas. Disease vector mosquitoes are tested on-site by the vector ecologist to determine if they're carrying the pathogens that lead to diseases like West Nile virus. Once samples are identified, if the number of human-biting mosquitoes is above the tolerable threshold, the next step is control. Field staff use data from the entomology lab to prioritize treatments. The primary method that MMCD uses to control mosquitoes is larval control, using active ingredients like BTI, which are specifically designed to target mosquito larvae without impacting other animals like pollinators. The materials are dispersed in the water via helicopter, drone, backpack, or by hand. When disease is found in mosquitoes, MMCD may respond with adult mosquito control to reduce risk for residents in the area. This method is used sparingly, and residents can sign up for alerts on the MMCD website. After control measures have been taken, the next step is to review. This involves checkbacks to ensure materials were effective in the amounts used, and additional surveillance to gauge timing of treatments and non-target impacts. Studies may be conducted and data is collected that will inform future work. Finally, an important part of IPM is education. Did you know that a bucket of water in your backyard may also be producing mosquitoes? MMCD does lots of public outreach to ensure residents understand mosquitoes and take protective measures to reduce the chances of getting bitten. All of these steps combine to form integrated pest management.